My name is Tariq Thannoun, and I'm an interventional cardiologist at Cardiovascular Specialists of Texas. I was always interested in medicine from a young age. I think it's a very unique field where you can offer people meaningful impact in their life. And then I had also a little bit of guidance from my dad, who is a gastroenterologist. The types of patients that I see are pretty broad, just being a cardiologist, so I take care of coronary disease, heart failure, heart rhythm problems, blood pressure, cholesterol, peripheral arterial disease, pretty broad skill set that cardiology has to offer. One of the fortunate things about this clinic location is that we're directly attached to the emergency room at St. David's North Austin Medical Center. So anytime someone has any sort of urgent, time-pressing condition, I wheel them across the hall and we get them taken care of right away. And in my opinion, if the patient is not able to understand and respond back to me what I've told them, then I haven't done my job. So a lot of the time in medicine, and especially in cardiology, we throw out a lot of terms and words and conditions. And so I feel that it's imperative that we take the time to explain them. And so instead of saying, you're having a myocardial infarction, I tell them, I think one of the vessels in your heart is blocked, and that's what's causing your chest pain. And I think it's time that we do a procedure to open that up. I had a patient who I just started seeing a couple of weeks ago who was having horrible chest pain, and it was limiting her life. She couldn't walk from her bed to the door in her bedroom, horrible pain. And we did a procedure called a coronary angiogram, and we opened up her artery. And I saw her in clinic last week, and she's a new person. And she can walk for 45 minutes now. She enjoys her quality of life. And again, this sounds made up, but I saw her in clinic, and she asked if we could take a picture so she could send a picture of me to her family as the man who saved her life. And that was one of the most meaningful, profound moments I've had in my entire career. And I think what's awesome about cardiology is that moments like that are not infrequent. We can offer really powerful impact on people, and that's what keeps me going.